uninsured and your income is under 250% of federal poverty level, you have to be given the lowest negotiated rate. And I had this incredibly satisfying thing happen this year where a gentleman wrote to me who had been seen at an emergency room with chest pain and had some outrageous bill, which they cut down to less outrageous for him, but was still pretty high. And I sent a letter to the hospital administrator, who I knew, saying, this still seems pretty high based on the income he tells me he has. And it actually got cut from $40,000 to $10,000. And so it was unfortunate that he had to know enough to write to me, and I had to write to them. And so one of the things we're looking at this year is what kind of compliance enforcement can we put into that other bill to be sure that when this happens, people don't have to go to those extents to get their needs covered. So, and then the final thing I want to look at a little bit more is we provide governmental immunity to all the physicians who work at University Hospital. And I see that as a benefit we give them. I'm told by COPIC they would spend about $30 million insuring their physicians a year if they didn't get our governmental immunity. And so I want to be sure we're getting at least that much worth out of indigent care out of University Hospital. I was quite alarmed by their profit margin that was reported last year of $24 million. I'm not sorry, it was 21% profit margin. And so a lot of people outside of Denver County are still having trouble accessing specialty care. And so I want to see if there are any teeth in that, how we can look at that and be sure that either university buys their own malpractice or we get enough care for our indigent and uninsured to make up for the fact that we're providing this governmental immunity for them. So those are some of the things looking at policy-wise. One last area is, I hate to call it this, but most people understand it this way, as malpractice reform. And and part of why I want to do this is that the stereotype is that Democrats are friends with trial lawyers, right? And that we are all about suing doctors. And actually what Democrats are friends of is the underdog, and all about being sure that people who are hurt get something to compensate them for that if it's irreparably damaged their life. But in medicine, what's ended up happening is this culture has developed where unless somebody fesses up that something went wrong, you never know that something went wrong. And one of the things that happened last year when I was in the legislature, different long story, is I wasn't in support of the naturopathic doctor bill. And people kept saying to me, how can you be worried about them practicing safely when doctors kill, 144,000 people a year, whatever it might be. And one of my thoughts was that part of the issue in not improving that number is that no one's willing to say this mistake happened because they're always afraid they're going to be sued. And so in Oregon, they're doing a pilot project where the process is that when something bad happens, you have a meeting with the patient and their family and say, this unexpected thing happened, this is why it happened, this is what we're trying to do to make sure it doesn't happen again, and this is what we're going to do for you and what you might expect in the future. And interestingly, most people are just happy with that, but they have the right then to go on and ask for mediation for a settlement, and then if they're not happy with mediation, they still have the right to go on and sue. Now the biggest obstacle to this actually is doctors, because they're not comfortable saying, I made a mistake. And I even hate to say I made a mistake, because sometimes it's like, 1% of the time when we do this happens, you were my 1%. So it isn't even necessarily a mistake, it's just what happens. So I'm going to test the waters at the governor's office and the trial lawyers and the medical society and see if I can get some buy-in for trying to do something like that in our state. COPIC already has a couple of pilots around this at Poudre Valley, and they said it's going really well, so I want to see if I can get that going forward. I think it's important for people to acknowledge when something has happened. A lot of times it's all a person wants to know. They know something's not right, and they really want to know that, and then figure out what could have been done systematically, just like in the airplane crashes, to keep that from happening again. So those are all the areas I'm looking at this in from. But what's on my mind, first and foremost, are the recall elections. And I have here some papers that I'll pass around telling you who you can contact if you're willing to help with these recall elections. And I know Elliot's going to talk about them. They're very historic in a bad way. And for me, what's interesting is there are a lot of people who felt like speaker, I said this, but Senator Morse really pushed him on a lot of things. Senator Morse is an incredibly progressive Senate president, and very willing to say, you know, this is what I want to do, and not back down unless he just doesn't have the votes to get it done. And of all the things he did, I don't, the gun violence prevention legislation he did was not, I don't think, the most progressive thing. I mean, there are a lot of really progressive things we did, but it's the thing that's garnered attention. And it's a hot button issue. And so I think it would be very detrimental to how progressive we can see things be in the future if either of these recall elections are successful. And so this is information on who you can contact and help. The date is set for September 10th. I don't know what HD2's volunteer efforts and funding is like, but if there's a weekend day that you guys can get a busload of people to go down and help in either of the districts. I read something in Mother Jones the other day that was encouraging, which is that the nice thing about September 10th is that Colorado College is back in session. And Colorado College is in President Morse's district. So if we can get a good turnout from Colorado College, I think in President Morse's election is closer than Angela Hirone's. Angela, if we do a good get out the vote, should be able to win if there's not a good Democrat to replace her. And they're discouraging other Democrats from trying to come in. But President Morse will need a very, very strong activist effort to keep from not winning. And I think we're going to see infusions of millions of dollars on both sides of the equation here. You know, rumor has it the Koch brothers are involved. They're trying to get mayors against illegal guns to make a huge infusion of cash. So it's going to be great for our economy, especially for the rest of us. So I'll stop there.
Simply around the gun issue?
Yeah.
Oh, that's their
Millions of dollars just to,
Yes.
just to prove a point about the gun issue.
No, they're
So-
just using that as the wedge.
Right. So it's in 2014. So the House is pretty safely Democratic. It's 37, 28 Democrat, and most of the House districts are broken down small enough that the swing districts aren't that many. I think there are 3, maybe 4. So the House should stay Democrat no matter what. With the Senate, we have a 2015 lead, which means if we lose 3 seats, we're not in the majority anymore. And we actually have 5 or 6 tight races next year. And Senator Hirone's was not on the list as a tight race, but because of this, it is now a tight race as well. And so we are in real danger of losing a majority of the Senate in 2014. If we lose both of these recall elections to Republican, we're still in the majority for 2014 session, but we start out with now needing to win every single election we have in 2014. And so that's what this is really about, is setting the stage for 2014, keeping us at 20, and then seeing what we can do to mobilize people to keep a Democratic Senate. Yes, sir.
When do your town hall meetings start again?
We're going to start again in September.
Okay, those usually, what, Wednesdays or?
Often Tuesdays.
Okay, and where are they at?
I would vary them. So I've been
Okay.
using the Washington Park
Okay.
West
Community Center?
Community Center,
Okay.
and then going way west like in Harvey Park.
Okay, and they'll be on the newsletter, right? That, the
Yes,
date
sir.
and time?
I have to acknowledge, I just got trained the other day how to do my own newsletter. I saw all these other legislators putting those out, and I thought, this can't be that hard. This is somebody showing me. So you're going to get my first newsletter in a long time this coming week.
Great, okay.
Yeah,
Okay.
and it wasn't that hard. Now, what I'm still intimidated about is website. Halisi told me she could teach me how to do that too. And I'm like, let me get a few newsletters out first, because if I have too many things to do, then I'll be nervous about it. But if any of you love to play with websites, let me know. I'd be happy to take your help.
I just wonder if are you getting any support in the Senate with your healthcare work?
You know, I have to tell you, I had run 2 bills. One was for constitutional referral, which I didn't really expect to see go forward. And the other was for an interim committee. And I had really strong support from my colleagues in the Senate. I was very pleased. I mean, even people who used to be sort of wafflers really understood the points I was making. And so I feel good about the Senate because I'm not in the House. It's a harder place to to build support. And interestingly, there were a couple of House bills that were in healthcare that I did not support, that I think probably built a little bit of ill will with those folks. And as you know, healthcare is sort of complicated. So this one bill, it made sense. They said if a woman had an abnormal mammogram that needed repeat films, that they wanted the repeat films to be covered 100%. Well, unfortunately, that's not in the Affordable Care Act. So every time you add a new mandate at the state level, the state has to pay the difference in the insurance prices. So I said, you know, I'm not supporting this not because I don't think it's the right thing to do, but because the way the system is set up now, it's going to bite the state. And then what's going to happen next year is people who have an abnormal colonoscopy are going to come in and say, well, now they won't cover my repeat colon because it was abnormal. You know, I mean, there are just so many gaps here. But I do want to fix this with my universal health care. So, but, you know, still it was frustrating for people because they didn't understand the nuances of why.
Sounds good.
Right, it sounds good, but within the, and to me that's sort of illustrating what the limitations are of the current system. Right? And then the other one had to do with biosimilars. In fact, former Representative McGean was lobbying for this bill about biosimilars, and interestingly, one of the future games coming up is that biopharmaceutical companies are trying to make it hard for biosimilars to be substituted because that will cut into their profit margin. And this bill would have made it easy for them to be would have made it hard for their drugs to be substituted. And so I opposed it. And
Is
so
that like generics? Biosimilars or something?
they're like generic biologic drugs,
Which is a new,
new emerging market, right? And the FDA hasn't set their rules yet, and there's some thinking that the FDA rules are going to be more permissive than this law would have been. So I felt like it was a little premature. We needed to be sure we didn't inadvertently shoot ourselves in the foot.
sounds like we're leading the federal government in all that healthcare.
We really are, because we are able to get more consensus here.
Is there anything else the state, we can do at the state level about the overall cost of pharmaceuticals?
So I'm actually going to go tour with this group called Express Scripts. And disclaimer, the chief medical officer for Express Scripts was a chief medical resident with my husband here at CU. But what they do is they do nationwide bulk purchasing, and they do mail order to patients. And so they have really low rates. And I'm going to go tour their facility and get some sense about, is there some way we can harness this for our patients? And actually, ideally, even just to our pharmacies. Because I don't want our little pharmacies to go out of business either.
Become wholesale.
Right, but could they somehow become an intermediary for our pharmacies? So, but in general, pharmaceutical laws are regulated at the federal level. But if we could find a little game like this.
No, I was thinking in terms of purchase power.
Yeah. You know, we did pass that bill to allow us to look at doing universal vaccine purchase. It was very controversial as well initially. And so I was hoping that would sort of soften the soil for this idea of look what we can do if we buy as a group.
Our group was happy with the way Senate Bill 127 was initially drafted. Not so happy the way it was passed. That's the one on funding the older Americans.
Oh, okay.
And I just wondered if there's still a possibility, or hopefully a probability of getting more permanent type funding.
You know, I think that seniors are a group that have, in general, bipartisan support. So I would see that as a viable option for the future.
You might tell our own representative that, because he seems to be wanting to protect the budget rather than the people on that issue.
Yeah.
Well, he's in his thirties.
Yeah. So our budget forecast in June came out really great again. And in fact, we have, I forget the amount, it's like 211 million more next year than we had budgeted for. So our economy continues to grow like gangbusters in Colorado. And so if this continues, it's expected that people will start getting TABOR refunds actually in another year or two. So that's a different story. But overall, that's good for us, is to have that happening. And as you know, there's the effort for the oh, so here's some good dirt. I love to take nice dirt. So there's this effort around the school financing next year and a bill on the ballot to increase funding by $1.1 billion. So apparently the really, really rich people don't like the fact that it's a progressive tax and are going to put money into fighting it. And it's progressive like 4.78 versus 5.2. I mean, it isn't dramatic, and it's only income over 75,000. But the really, really rich people are pissed that we're going to set a precedent for a progressive tax. And rumor has it they're going to put lots of money into trying to defeat the ballot measure.
It's glitter bomb.
Yeah. And I won't name names because I don't know this for a fact. It's just names that have been named to me, but they're names that you would know. So, yeah.
On
Yes,
a little
sir.
more personal note, there was a blurb in the paper about a month ago that you kind of were moved into a new arena for yourself, away from the legislature. Do you want to tell us about it?
Yeah, so if you have a doctor's license, to keep it active, you need to practice medicine. And if you don't, you can't have an active license. So I needed to practice medicine during the interim because I do want to still keep my license active. I am now on the board of Denver Health and Hospitals Authority. And so as a board member, I'm not allowed to work for them. So I'm working at Clinica Tepeyac, which is on 50th and Lincoln, and it's a clinic that ends up serving primarily the undocumented, actually. And it's a sliding scale. You know, they ask everybody to pay, but they don't refuse anyone if they can't be seen. And it's been really fascinating for me because working at Denver Health, once somebody got in, pretty much we had access to anything. Whereas at Clinica, we don't. So I'll see somebody and it's really a matter of, okay, for $300 I can get you an evaluation for the surgery and they can give you a payment plan kind of thing. So it's really interesting where every single time you think about ordering something as simple as a urinalysis, it's going to cost them something out of pocket. So you're sitting there weighing, okay, how much is this going to change what I'm going to do clinically? How important is it for them and things like that. And what's sad is I saw two people already that sort of, this is good for me because it's just going to keep me being a crazy healthcare reform person. But one was this gentleman who was just diagnosed with diabetes, and he had high blood pressure. His blood pressure was out of control because he said he couldn't afford his medicine, and now he has diabetes. And it's expensive to take care of diabetes. And the thing is, if we don't take care of these, he'll end up on dialysis, and then he'll be on Medicare. So it turned out he's Native American, and I said, I hate to say this, but if you can get into Indian Health Services, you should, because they will help you be able to afford what you need to take care of your diabetes, because it's really important that you control it. And then I saw these two women who were undocumented. One had, same thing, diabetes, wasn't affording to take her medicine, had it poorly controlled. The other had just been discharged from University Hospital after being in the ICU for 4 weeks with a complication of uncontrolled diabetes. And I thought, this is why we need to take care of this woman. Because this is going to happen. They're going to end up in the hospital, and we're going to pay for it. So it's maybe not so good that I'm there, but but it's giving me a sense, and I'm going to obviously try and figure out how to help them get the support they need for other things. So they're very happy to help me there because now I can see firsthand what the issues I can face.
Thank you so much.
You're welcome.
Any further questions? If not, we'll move on to having Elliot come. Yes, sir.
Is it possible for an individual to become a so-called navigator to explain the Affordable Care Act to individuals who need explanation?
You know, you might want to call the Connect for Health Colorado folks. I would bet that there'll be a number of the Outreach Navigator people will be hiring folks. And then also, I'm sure they'll have a volunteer network if you're interested even in just volunteering. So,
Who was that? Already?
it's Connect for Health Colorado. That's the name of our exchange now, is Connect for Health Colorado. And there's so many things because I haven't seen you in forever, but one thing I want to tell you is that we are by far doing better than any state in the nation on our health exchange. We have at least 10 different insurers offering at least 150 different products. And there are literally states that can't get anybody or only one insurer to offer a product. And And in addition to that, we have all our navigators being hired, and they're starting advertising to get people aware of it. So they still plan to be ready in October for folks to get on and figure out about their discounts.
There's a story in the Times this week that said that in New York, they were seeing the prices for insurance policies for individuals drop by 50%. Are we seeing those kinds of improvements here in Colorado?
So our plans have been submitted and prices have been submitted, but the Commissioner of Insurance has to approve them. So we've not seen the final prices yet to see how they're going to compare. I know that even as they were submitted, they were at or below what's currently being paid. But I don't know that we're seeing, I didn't hear that there was a dramatic decrease, but there was not an increase.
So it might be that we already have a better price control than
Yeah.
New York State has.
Yeah, that wouldn't
That's
surprise
the
me.
really big conclusion is,
Yeah.
these big drops are because they had no controls.
I just
Yeah.
wanted to offer a comment on something that you had said earlier. You said that the governor's decision on the death penalty created a more difficult playing field for moving that forward next year. I offered that it was his unwillingness to make a decision on it that created a great deal of the blowback, and that while right now I'm sure a lot of Colorado is not with us on that conversation, I think that most people want to be having that conversation. The
Yes,
blowback
I
is
would
against avoiding.
Yeah, I just meant it's not going to
So-
be a year to introduce a repeal the death penalty
It
bill,
may
but it
be-
is still a time to move that conversation, or not, I shouldn't say, you can introduce it, but not necessarily expect that it will move forward. But it is still a time to have that conversation. You know what's interesting, we had a meeting with the governor, and one of their representatives, it was the Latino caucus, said something to him about, if you feel like we're doing something, you know, and it's just too assertive or whatever, let us know and we can, you know, think about pulling back. And I said, well, that's true for the House, but not the Senate. He said, yeah, I know that. and then somehow the death penalty came up, and he said, because he said, when have I interfered? I've not interfered. And I said, well, what about the death penalty? And he said, well, you know, that's one of those things where I feel like we need to let the people talk about it and see what they think about it and get some feedback. And I said, well, it depends on your position on the death penalty, because if you think it's fundamentally wrong, that's like asking people if slavery is okay or not.
Right.
You know, and if you don't think it's fundamentally wrong, then that discussion is relevant. And then, of course, you know how when you leave, you always think of something else you should have said? As we left, Senator Guzman said to me, and I said, oh, you should have said this in the room. She said, why don't we see what the people think about fracking? And I said, you should have said that in the room. But anyway.
Okay, well, thank you very much. It's always a litany. You have one more. Can't let you
If you're
go.
going to have a conversation with the governor about death penalty, was there any conversation with the governor about how poorly managed the other aspects of criminal justice?
Yes.
I mean, that's pitiful,
Yeah.
pitiful, that they're
Yeah.
letting people out before they belong out. And we got people killed over that.
Yeah.
I mean, death penalty is easy for the governor.
Yeah.
He
You know,
doesn't care.
what's I'm now on judiciary, and so that's one of those areas I'm feeling really concerned about. And I think that part of it is the big push in criminal justice is to try and get people rehabilitated so they don't become recidivists, because so many of them are recidivists. And so a lot of our laws have been softened on crime to keep people in the community. And I think what we need to be sure is that the softened crimes really are for nonviolent crimes. Because the idea is primarily people with addiction and mental health illnesses who do behaviors, or, you know, if you just steal somebody's money, now that's just, but you don't hurt anyone and you're getting money from them to buy your drugs, that's different than if you go and you kill somebody to get drugs from them. And I don't know what the, what kind of separation there is in terms of how those decisions are made.
My point is that it's absolutely poorly managed, and I haven't seen anything be done about that.
I know they actually have fired some people, and they've gotten a new director in, and it's recognized that it's an issue. And so it is being worked on. I had the opportunity a couple of weeks ago to go tour Pier 1 in the Haven on the old Fort Logan campus. And there were a number of people who work there who are criminals from in the prison system who've been reformed, drug-related. And they'd offer to have a meeting with me and bring together some recent criminals to talk about the culture in the jail. And because I was really concerned particularly about that whole white supremacist thing going on between different prisons and things. And so Senator Guzman said she'd be interested in that. So we're trying to arrange for the Judiciary Committee to meet with these people who had recently been released from Canyon City and hear what they think is going on and what things they think might be able to help us in that regard. Because
That's great.
that was the scarier thing for me, was hearing about that subculture that was going on, even more so than the poor decisions that were being made or allowed to slip by. Yeah.
Who's the chair of the judiciary this coming?
Lucia Guzman.
She's gonna still.
Yeah.
Thanks.
Yeah, you're welcome. All right, thanks guys. I'm headed over to the Latino Initiative meeting to get volunteers also. And I'll
Just to reiterate, if anybody has the time or the inclination, we do have this